Hello guys, welcome to Anatomy Tamil. In this video, we are going to see about the tympanic membrane. Now let's see what's tympanic membrane. The tympanic membrane is a partition between the external auditory meatus and the middle ear cavity. Let's see in this picture. This is called the external acoustic meatus, and this is the middle ear, and which separates the external acoustic meatus and the middle ear is called the tympanic membrane. And this part and it's marked here, this is called the tympanic membrane. Hope you got it. Now let's see the general features of the tympanic membrane. Okay, it's thin and it's a translucent partition which separates the external acoustic meatus and the middle ear. Okay, it forms the lateral wall of the middle ear cavity. Okay, it's oval in shape. The dimension is 9 into 10 mm. That is, its largest diameter is 10 mm and the smallest diameter is 9 mm. It is placed obliquely at 55-degree angle with the floor of the meatus. Got it? Now let me show you a picture. Got it. This is the picture. You can see here it forms 55-degree angle with the floor of the external acoustic meatus. This is the external acoustic meatus. Got it? Yeah. Now it faces downwards, forwards and laterally. Okay. Okay. Now let's see the surfaces of the tympanic membrane. The tympanic membrane actually has two surfaces, the outer surface and the inner surface. The outer surface concave irukkum. Okay. The inner surface is convex. The outer surface is concave, which means it's like this, and the inner surface is convex, which means it's like this. Got it? Okay, the outer surface is concave and lined by the thin skin. Okay, the inner surface is convex and provides attachment to the handle of malleus, which extends up to its center. The handle of malleus, which extends up to its center. Okay, the point of maximum convexity lies at the tip of the handle of the malleus and is called an umbo. Okay, the umbo is present in the inner surface of the tympanic membrane, where there is a maximum convexity. Got it? Now let's rewind once again. It has two surfaces, the outer surface and the inner surface. The outer surface is concave and is lined by the skin, thin skin, which means the thin skin has hair. Got it? The inner surface is convex, provides attachment to the handle of malleus. You can see here in this picture, this is the inner surface of the tympanic membrane. It has the handle of malleus here and it extends up to its center. Got it? Hope you got. The point of maximum convexity is called umbo. I have shown this in the previous picture, and this is the umbo region. The point of maximum convexity. Got it? Good. Now let's see about the circumference. Okay. The tympanic membrane is thickened at its circumference, which is fixed to the tympanic sulcus. The tympanic membrane edges circumference, the edges thick ah irukum. Got it? இது வந்து tympanic sulcusல அட்டாச் ஆகி இருக்கும். இதுக்கு superiorly the sulcus is deficient. அதாவது இங்கே மேலே sulcus கிடையாது, அங்கே என்ன இருக்குன்னா tympanic notch. Here the membrane is attached to the tympanic notch. Got it? From the end of the tympanic notch, this is the thickened part, and here is the tympanic notch. From this both ends we have the two malleolar folds, the anterior malleolar folds and the posterior malleolar folds. Got it? Yes. Now let's see the parts of the tympanic membrane. It has two parts actually, the pars tensa and the pars flaccida. Okay, the pars tensa is tightly stretched and the pars flaccida is loose, and the pars flaccida layer is found between the two malleolar folds. The pars flaccida layer, which is crossed by the cauda tympani nerve, the pars flaccida layer is more liable to rupture. Okay, it ruptures easily. Okay, the pars tensa is tighter, and the pars tensa forms the greater part of the tympanic membrane, and the pars flaccida forms the lesser part of the tympanic membrane. These are the easy points, you can grab it easily. Okay, that the tympanic membrane is held tense, that means it's tense by the inward pull of the tensor tympani muscle. Tensor tympani muscle plays a very important role here, and the tensor tympani muscles, which is inserted into the upper end of the handle of malleus, which means this is the handle of malleus, and the tensor tympani muscle must be attached to here. Got it? In this area. Okay, now let's see the structures of the tympanic membrane. The tympanic membrane is composed of 3 layers: the outer cuticular layer, the middle fibrous layer, and the inner mucus layer. Now let me show you these things in the diagram. Okay, well, this is the outer cuticular layer, and this is the middle fibrous layer. Got it? And this is the inner mucus layer. Now let's see what are the features in these things. Okay, the outer cuticular layer is formed of skin. Got it? The middle fibrous layer is made up of fibrous tissue. The inner mucus layer is made up of what? The ciliated columnar epithelium. Got it? Let me remind you once again. The outer cuticular layer is made up of skin. The middle fibrous layer is made up of superficial radiating fibers and the deep circular fibers. The superficial radiating fibers and the deep circular fibers. Let me show you here in these things. Okay, this is the superficial radiating fibers, and these are the circular fibers. Got it? Okay, there's an important point here. The middle fibrous layer is replaced by the loose areolar tissue in pars flaccida. You can see here the 2 malleolar folds, the anterior malleolar fold and the posterior malleolar fold, and this is the pars flaccida, and here it is replaced by loose areolar connective tissue. Got it? Yes. The inner mucus layer is lined by low ciliated columnar epithelium. Let me show you once again. Where's the picture? Yeah, got it. This is the low ciliated columnar epithelium. Hope this is clear. Let me revise you once again. Outer cuticular layer, which is formed of skin. Middle fibrous layer made up of superficial radiating fibers and deep circular fibers. The deep circular fibers, which is maximum in the center. Okay, it's maximum in the center and is minimum at the periphery. Hope you got this. Again, the middle fibrous layer, which is replaced by loose areolar connective tissue in the pars flaccida, which means pars flaccida middle fibrous layer irukad, அது loose areolar connective tissue தான் அங்கே இருக்கும். Got it? The middle fibrous layer என்ன இருக்குன்னா low ciliated columnar. outer cuticular layerனா outer surface, அது ஸ்கின்னால ஃபார்ம் ஆகியிருக்கும். புரிஞ்சா? இனி blood supply பற்றி பார்ப்போம். outer surface, இந்த tympanic membrane outer surfaceல deep auricular branch, அதாவது deep auricular artery சப்ளை பண்ணும். இன்னர் சர்ஃபேஸில் anterior tympanic branch, posterior tympanic branch. Got it? These things are more than enough. If you want, you can write these things too. The deep auricular branch, deep auricular artery is the branch of maxillary artery. Anterior tympanic artery is the branch of maxillary artery. And the posterior tympanic branch is the stylomastoid branch of the posterior auricular artery. Okay, now let's see the lymphatic drainage. Now let's see about the lymphatic drainage, pre-auricular nodes and the retropharyngeal nodes. Okay. Now let's see about the venous drainage. Got it? The outer surface by the external jugular vein and the inner surface transverse sinus and the venous plexus around the auditory tube. Transverse sinus and the venous plexus around the auditory tube. Now let's see about the nervous supply. Outer surface, anterior part, which is supplied by the temporal nerve. Posterior part which is supplied by the auricular branch of vagus nerve with a communication branch from the facial nerve. Inner surface is a tympanic branch of glossopharyngeal nerve through tympanic plexus. Hope these things are clear. Let me revise you once again. Tympanic membrane which is thin and translucent between the external acoustic meatus and the middle ear. It forms the lateral wall of the middle ear. Oval in shape, dimension is 9 into 10 millimeter, placed obliquely at 55-degree angle with the floor of the meatus. It faces downwards, forwards and laterally. Surfaces, it has two surfaces, outer surface concave lined by thin skin. Inner surface convex provides attachment to the blunt handle of malleus which extends up to the center. The point of maximum convexity lies at the tip of the handle of malleus which is in the middle ear and it's called umbo, which is important. Okay, now let's see. Okay, the tympanic membrane is thickened at its circumference which is fixed to the tympanic sulcus of the temporal bone on the tympanic plate. Superiorly, the sulcus is deficient. Here the membrane is attached to the tympanic notch. From the end of the tympanic notch, two bands, the anterior and the posterior malleolar folds, and are prolonged to the lateral process of the malleus. The tympanic membrane has two parts, pars tensa and the pars flaccida. Pars tensa is tightly stretched and forms greater part of the tympanic membrane. Pars flaccida loose between the two malleolar folds, crossed internally by the cauda tympani, more liable to rupture than the pars tensa. The tympanic membrane is held tense by the inward pull of tensa tympani muscle inserted into the upper handle of the malleus. Got it? The structures of tympanic membrane is composed of three layers. Outer cuticular layer which forms the skin, the inner fibrous layer made up of superficial radiating fibers and the deep circular fibers. The radiating fibers and the circular fibers. Got it? The middle fibrous layer which is present only in the pars tensa and is replaced in pars flaccida by the loose areolar tissue, and the inner mucous layer which is lined by loculated columnar epithelium. Let's see the blood supply. In the blood supply, the outer surface and the inner surface. The outer surface is supplied by the deep auricular artery, which is the branch of maxillary artery. The inner surface which is supplied by the anterior tympanic artery, which is a branch of maxillary artery, and the posterior tympanic artery, which is a stylomastoid branch of posterior auricular artery, which is internal branch of external carotid artery. Now let's see the lymphatic drainage. There are two lymph nodes here, preauricular lymph nodes and the retropharyngeal lymph nodes. And drainage, the outer surface by the external jugular vein and the inner surface by the transverse sinus and the venous plexus around the auditory tube. The nervous supply, the outer surface which is categorized into two, the antero-inferior part and the postero-superior part. Antero-inferiorly by the auriculotemporal nerve and the postero-superiorly by the auricular branch of vagus nerve, which is communicating branch from the facial nerve. Okay, the auricular branch of vagus nerve with a communicating branch from the facial nerve. Inner surface, the tympanic branch of the glossopharyngeal nerve through the tympanic plexus. Got it? The nerve supplies are too important. In the next video, we will see about the tricks and the mnemonics to remember the nerve supply, the blood supply, venous drainage, the lymphatic drainage, and few features. So hope you like our video. If you have any doubts, please comment below. If you want any topic, you can mention in the comments. You can take this note from my Telegram channel, which I'll be giving the link in the description. Thank you guys. See you guys in the next video. Thank you.